everyone, once again welcome to my Oet channel. Today I came with one role play explanation. So most of the students have difficulty to handle home visit role play. So the introduction is somewhat different from other role plays. So here I have one example. I will present to you how we have to start and how is the flow and how to conclude the role play of home visit. Okay, so this setting is home visit and you are a community nurse making a routine visit to a 67-year-old patient who is recently been discharged following a coronary bypass operation. The patient's doctor has asked you to give him or her a flu vaccination. So first of all, we have to read this paragraph and what is the content, what is your role and to whom you are talking, whether it is known scenario or unknown scenario. Known scenario means you have started already the conversation, you have started. Example, you have just examined, like that means it is a known scenario. And who sent to you, to whom you are talking, whether they are female or male or old age or parent or daughter or son. So like that, different according to the position, the way of talking will be somewhat different. So here actually home visit means you will be mostly community nurse or you will be the district nurse. Here you are the community nurse and you came here as per the instruction of general practitioner of this patient. And the purpose of your visit is to give flu vaccination. So another one more thing I want to explain you. This is like only one visit for flu vaccination. Only for flu vaccination when you are here. But sometime home visit means maybe for the follow-up and for just for monitoring. So in that scenario, the conclusion will be different. And here the conclusion will be different because this is only one visit. So just we will go to the first task, find out how the patient is feeling. Then I will just start with the instruction of introduction because the introduction of home visit is somewhat different as I told you. First, during 3-minute preparation time, you have to ask the name of the patient. Example, this patient's name is Peter. Then how we can start? Always start with the greeting and your introduction. Okay, then you have to confirm whether this is the patient's home. Then you have to confirm whether this is the correct person and you have to tell the purpose of your visit plus the permission to continue your conversation. So this all things should come in the introduction. So we can start like this. So we know that patient's name is Peter. Good morning. Then get back the greeting. My name is Reshmi, one of the registered nurses working in this community health center. If I am not wrong, is it Mr. Peter House? Then the answer will be yes, it is. Then we can ask, am I talking to the right person? Then the answer will be, yeah, I am Mr. Peter. Then we can tell, hello Mr. Peter, glad to meet you. Actually, I came here as per the instruction of your general practitioner for providing flu vaccination. Is it the right time to talk with you? So these many things you have to ask to the patient. Then if you are getting permission, then you can go to the next task. Explain the purpose of your visit giving a flu injection. Emphasize that the flu can be life-threatening for patient with a heart condition. Then we can tell that as Peter, as I informed you, actually I came here for the flu injection and I would like to inform you the importance of flu vaccination for you. So may I proceed with that? Like that we can ask. Then we can tell that it is actually flu means it is a life-threatening for patients with a heart condition. So as you know that you have undergone a coronary bypass operation recently, isn't it? So your general practitioner has advised for this flu vaccination to prevent further complication. Are you getting my point? So we can conclude with that. The next task is explore the patient's concern. Reassure the patient that the vaccination cannot cause flu. Describe possible side effects also. They have given soreness at injection site, headache, muscle ache and all. Then stress that these are mild and temporary. Multiple contents are here. So then we can ask, are you getting my point? Then patient have some concern. Patient is telling you that, sister, to be frank, I'm afraid of these injections and I don't want this because I'm staying inside a home and I'm not going outside. That how I will get this flu? Then we can answer like this. Mr. Peter, I can truly understand your concern, but I would like to reassure you that this vaccination is very much essential for you in this time. So before proceeding further, may I know exactly what is the reason behind of your decision. Then patient is telling that I heard that this flu vaccine will cause flu. Is it correct? And moreover, I am so much concerned about the side effects. Really, I don't want to become sick. I know that after the injection, I will become sick. Then we can answer like this. I can understand your concerns, but no need to worry. I can explain you in detail. Some people, they are believed that this flu vaccination will cause flu, but it is not correct exactly, because this vaccination contains inactive virus. It is not active virus. So it will not cause flu, but there will be some side effects as you told, such as soreness at injection site, headache or muscle pain. But no need to worry. With the use of over-the-counter medications, you can relieve your symptoms. You can get relief from the symptoms within 1 day. How does that sound? Like that we can ask. And the next task is answer the patient's question about a vaccine. Reduces the susceptibility to flu by 40 to 60%. One annual injection sufficient, effective 2 weeks after administration. Then the patient concern, we can ask, do you have any more concern about the vaccination? The patient's question is that how you can tell that it will reduce the chance, or it will eliminate the chance for flu. How can I believe, and how much it is efficient? So how long the effect will be there? Like that, many questions will be there. We can answer for that. Yes, Mr. Peter, actually it will reduce the susceptibility to flu by 40 to 60%. I am not telling you that you will not get flu, but if you are getting also, the susceptibility to get the flu is very less. And one annual injection is sufficient for you. After the injection, within 2 weeks, you will get the complete effectiveness. So are you getting my point? Then it's finished. Then advise him or her that patients with the heart conditions are at risk from flu, like weakened respiratory system can attack heart muscles, increase likelihood of cardiac arrest. Explain that severe form threaten heart patient. Most immunization can also reduce severity. So then we can ask that, Mr. Peter, I hope all your concerns are answered. Still, do you have any more concern? And patient is telling that yes, I can understand what you are telling, but still I don't want, sister, I will talk with my general practitioner. Then we can tell that, Mr. Peter, I'm sorry to tell you that in this condition, because as like a post-operative patient, if you are not receiving this vaccine, I'm really sorry to tell you that you will be at a higher risk for getting flu. If you are getting flu, there is a chance to get weakness of your respiratory system and can attack heart muscles, and it will increase the likelihood of even cardiac arrest. But no need to worry, if you receive the vaccine right now, within 2 weeks you will get complete benefit, and if you are getting the flu symptoms also, the severity will be very less. Within simple cold and fever, it will finish within few days. So it will not affect your health anymore. So I hope I'm clear to you. Once again, I'm reassuring you that it is very essential for you to receive. And I can tell you that many of the cardiac patients, which are those who are in the same community area, they have received already this vaccination. So I'm strongly recommending you to get this vaccination right now. So how does that sound? Are you okay with that? Like that we can ask. Then patient is maybe convinced because of these complications and all. Then patient may answer that, oh, it's okay, fine, because I don't have any choice. So you can continue. Then we can ask, okay, I hope, Mr. Peter, I hope I have clarified all your doubts. If you don't have any other clarifications, may I proceed with the vaccination. Then with that, the role play will finish. So here actually, as I told you, this is a single visit. So within this visit, it will finish. So no need to tell anything more. But if the visit is continuing, means you have to tell that, thank you for your time which you spent with me. And if you need any clarification, you can contact with us anytime, like that. But here, no need. You just came for vaccination, and patient has given you the consent for vaccination. So you will give the vaccination and you will leave the home. So that's only the thing. With that, we can conclude the role play. So I hope it is clear for you. So just choose the home visit role play from the list. If you follow my Telegram group, means I have posted there. So you can take wherever you can find out, means you can go to the file section and you can see the PDF. In that you can see Oet role plays. In that you can search and find out the home visit and every other type of role plays also. So we will see with another one informative video. Until then, bye. Take care.